I'm Danielle Alexander. I work for Learning Care Group. I'm a regional manager. My region is considered the Desert Mountain region, which is Arizona and New Mexico. I oversee 64 early learning programs in all over the Arizona market, all the way from Tucson to Flagstaff and the Phoenix, obviously Metro, and then all of the Albuquerque. We have Santa Fe and some of the Rio Rancho schools in New Mexico. So
what names would people recognize?
You would recognize Tutor Time Learning Centers,
Okay.
Child Time Learning Centers, and La Petite Academy. Those are under my umbrella of brands, although we do have more brands under the Learning Care Group.
So let's talk about why families would choose that particular type of childcare for their children when they're making those decisions.
Well, I mean, we pride ourselves with quality. We are accredited schools all over the country. We, have the most health and safety standards. I mean, we are very regimented. Our safety practices are bar none among the industry. And, we just really pride ourselves in making sure parents can feel comfortable coming into our schools, getting a quality education for their children and a safe environment.
What's quality mean?
Quality to me means great education, great interactions, quality teachers that are degreed and passionate about learning and teaching children, and just growing and developing with the industry. And we pride ourselves on leading the pack.
So how has the COVID-19 pandemic changed the way that you're serving families? And who are you serving now?
Well, obviously, things have shifted quite a bit and it's moving very rapidly. Each day seems like a week. I'm sure you can relate. Just the way things are just moving. We're just trying to stay, entwined with what's happening and moving along as quickly as it's moving. Some of the things that we've done differently, I think, is just serving our communities in a different way, serving essential workers, serving our healthcare professionals, our first responders, our grocery and retail folks that have to get out there and get those groceries available for families, anyone that's considered essential by the governor, and even our childcare workers, they're essential. They're providing a service. They're coming out, they're risking their own health and safety every day to care for children because they're passionate about kids. And so we've shifted to really being focused on essential workers. And then our health and safety practices, they've just, we're doing temperature checks as people are coming in. We're doing routine. We've always had great safety practices as far as hand washing, even with accreditation, all of the sanitary and safety practices that you practice being accredited, but just ramping it up a notch to keep people safe, keep kids safe, keep our employees and our teachers safe. So we're just trying to really keep up with all of that, partnering with the CDC, making sure that we're doing all the things that they're recommending us to do to keep people safe in our schools while we provide quality care.
But certainly children don't know how to social distance. So how are your teachers handling that in the classroom?
I think they're doing it as much as they can. I mean, to your point, I'm watching children out on the playground and, it is hard to have them social distance, but I think at the rest times and meal times and the times that the teachers are really guiding the engagement and the interaction in the classrooms, they're able to social distance as much as possible. But we are keeping group sizes lower in the rooms so that, we're only doing groups of 10 since we are partnering with the CDC, trying to keep, combining classrooms and, different activities with a limited amount of children. So that's definitely helping.
I have seen a lot of information, or you see television ads, Facebook posts, et cetera, thanking first line workers, doctors, nurses, firefighters, police officers, grocery store workers, as you said. What about the people that are working for you? What about the teachers and directors in the classroom? Are they being acknowledged?
Yes, we are absolutely acknowledging.
But is the public acknowledging them?
I think that I will tell you, Vicki, that I think we have gotten, the word has been out more now than ever of what we do in our schools and how valuable our early childhood professionals are. I think that this pandemic, although it's it's a travesty for all of us in so many ways. It has really brought an awareness to childcare and how valuable we are and what we provide to the community and how people would not be able to go to work. We were, one of my locations is about 90% health workers, and they were like, we would not be able to provide the services to people who are in need if we didn't have somewhere to bring our children. So I think it's heightening, and I think our teachers need to understand how valuable they are. And I think we're trying every day to just keep showing them and keep doing things for them and keep thanking them, because they are valuable, very valuable, not only to us, but to the community.
How did you choose to become involved in this field?
You know, I've been doing this since I was out of college. I always was passionate about children. I've always been passionate about learning and early childhood, but making a difference with children 0 to 5 has always been a passion of mine. And I pride myself in leading my team to provide quality care. And that's why I'm passionate about accreditation, because I feel like it even takes our schools up a notch. And it really just, you know, everyone's prideful when you're accredited. It's the teachers, they're a huge part of it. They feel a sense of pride and value, and then just providing quality care. And I'm just passionate about children in general. So
when you say accredited, can you be specific as to what you mean? Because I think there are different accreditations that different centers get.
For us, NACCE accreditation is just the work we do every day, you know, supporting growth, development, education, not only for children, but for our staff. And also, you know, being validated by NACCE is, you know, one of the most influential organizations in the country.
And that's the National Association you feel.
Right. You know, the National Association. And so
for the education of young children.
Yes, I'm sorry.
It's a mouthful.
It is, but it's a very valuable mouthful. Yeah. But I mean, it's for us, it's just being part of something national and, you know, being validated, having them come into our schools and tell us we're the best of the best and we're providing the best care we can for kids is such a great partnership with NACCE.
Talk about when, what you thought about when governors and different entities across the country decided to close public schools for K through 12 because it was considered to be risky. And those teachers are now at home and doing some teleworking with their students. But the birth through 5 community, that wasn't so clear.
Right.
Why is that? What does that say about the way we view the infrastructure for how we care for our birth through 5-year-old children?
You know, I think that it just shows, you know, what the differences are. And I think there's a lot of, sometimes you know, they join us, or the philosophy is that we're kind of one of the same, but we really provide a very different service. I mean, we're providing care for working families, but we're also providing a 0 to 5 development skill that, you know, maybe not as easy to do remotely or easy to do via, you know, Zoom calls or Skypes or, you know, online. But we are, I mean, I will say one of the things that Learning Care Group has done over this pandemic is give our families who aren't able to bring their children or who choose not to bring their children online resources. We have a whole education program where you can go on with your child 0 to 5 and find activities, things to work with them on. And it's changing every day. So we have gone that route, but I also think, to your point, it's just very different than the education in the public schools. And we're servicing working families. So I think that's where it's different. And I feel for those families who work and have elementary education children. That's why we do offer care to 12 years old, so that if there are families that are essential workers, that we can help them during this time.
So some of your early educators right now are taking care of older children.
Correct. Yes, because there are some families that, you know, need care even though their children are not going to public schools because they're a doctor or a nurse or first responder or in those essential roles. Is Learning Care Group able to pay the teachers that are there now? Are they able to employ all the teachers, or have you had to lay people off because of the reduced sizes of the classrooms? We have done our best to keep as many teachers on board as we can. Obviously, with this pandemic has posed many operational challenges to the entire early childhood community. So we are trying to help. We have had to furlough some teachers but we have been being able to help them with transitional pay, benefit pay, and some things to keep them, you know, on their feet, or at least to help them through this transition.
Is it a benefit then to be a teacher at a larger group, learning group, such as yours, the Learning Care group, as opposed to, say, a small mom and pop or a home care setting?
I think there's probably some benefit to it, just because we have a lot of resources, and you know, we have been able to keep our schools open, especially here in Arizona. We've only had to close 5 of our 50 schools. A lot of that has just done to, we have been able to keep servicing essential workers, and you know, we are able to sustain probably a little bit longer, but you know, we still face the same challenges. I mean, there's definitely teachers that we've had to furlough just because our attendance has dropped about 65% of our norm at this point. I mean, I normally would service 6,200 children daily, and we're servicing about 2,200 at this point. So you can definitely see there's some operational challenges.
So let's talk a little bit about the Enrichment Center project. How will that impact your centers and your staff, teachers? Directors?
Well, it's been a huge win, and we're so grateful that Governor Ducey was able to push this project through, because it's giving scholarships, opportunity paid in full for essential workers, and it's also benefiting our teachers because they are also essential workers. So if they have children they have to bring into the schools as well, they're able to benefit from this scholarship. But it just rolled out in full last week, and we're already servicing up to 50 families just in less than a week's time that have qualified for the state program. So it's been a huge benefit. We're continuing to get applications and people getting approved for it. So, you know, the more essential workers we can service, the better. And it's really helping the Arizona market at all.
So that would be anyone who needs care for their child because they're on the front lines, whatever that profession might be. They go to a website and sign up. Is that how it works?
They go onto a website and they sign up. It's based on income. And if they qualify and they're below the threshold of the income, they would be approved. And then the state would pay for their childcare for the entire month in full. So they would pay nothing out of pocket.
So is there any going back after this? I mean, to have your child care actually taken care of for you.
I know. Well, you know, at this point, I think everyone just values what they're doing and how critical their roles are. And yeah, I don't know what the future holds for essential workers, but I think right now it's the right thing to do to really help these people out because they're helping out the communities.
Maybe some more public partnerships are on the horizon.
Absolutely. I hope so.
Do you think about those children that aren't coming to the regular program?
I absolutely do. And, you know, it's really kind of heart-wrenching. And honestly, I think about my own nephew who is in a tutor time school in Michigan that is closed right now. And I think about, you know, I know his mom's very engaged with him at home, but he loves his friends. He loves his teacher. Even my brother said, I would love if he could FaceTime with Miss Lori because these teachers are so valuable and they're so critical in these little lives, you know, and he misses her. He talks about her. And, you know, I feel for him because that social learning environment is just such a big part of his day, you know. Normally, the Week of the Young Child is just activities and awareness around early childhood educators, celebrating our children, celebrating our families, our teachers. This year, it's how do we stay connected? How do we, you know, have these great activities and awareness in our schools with our families, but also bring it to all of our families that are at home right now that can't be celebrating in our schools with us. And so we're going to just be reaching out. You know, the great news of today is the technology is better than it's ever been. You know, we can send out notes and videos and to our families who can't attend to make them aware of the Week of the Young Child, what we're doing. And also just, I mean, you said it earlier, our teachers, I just want them to know how valuable they are. That's to me, something that we need to celebrating our children and, you know, knowing that we're here for our communities and these kids. So that's what we're going to be doing. And we have a ton of activities, like I said, that they can do either in their schools or at home.
And just to wrap up, is there a silver lining to this, for this experience with the pandemic, for the childcare profession and the way the public will look at childcare?
I believe that if any silver lining comes of this, it's the value to what childcare providers do and early childhood educators, and how valuable we are to the communities we serve, and how we are dedicated. We have dedicated teachers here that come to work every day to make sure parents can go to work, and they love these kids, and they, you know, they challenge them, they give them great opportunities that they might not have at home. And it's just a positive thing. And I think it's going to give us even more positive recognition in the country as a whole.
Well, let's hope so.
I hope so. Yes.
Thank you, Danielle.
All right. Well, thank you so much. Appreciate it.